The human metapneumovirus, also known as HMPV, is reportedly surging in China. The virus is raising questions about how it spreads and if it could be a threat here in the U.S. Joining us now is Dr. David Hill, chair of the National Board of the American Lung Association. David, welcome, doctor. Good to have you with us. So just a brief description of what this HMPV exactly is, similar or different to other respiratory viruses?
So HMPV is a virus that causes the common cold in most cases. So it's similar to a lot of other respiratory viruses that circulate. It's something that is already here in the United States, first discovered around 2001, and has probably been circulating in people even longer than that. So the rise in cases are a concern, but this is not a threat like COVID-19 was.
Got it, because I think that's the first thing people think about. They're like, uh-oh, another widespread virus, which is originating there and could potentially get to our shores. With symptoms, that you said it's like the common cold. So are those the exact symptoms people should be on the lookout for?
Sure. So symptoms are, what you would think of as a cold. Low-grade fevers, body aches, a lot of nasal congestion, sore throat. Those are the common symptoms in healthy people. This is a virus that can make people who are at risk sick enough to go to the hospital. So it's, in most people, a mild disease, but in specific populations, it can be serious.
Let's talk about how contagious a virus this is, any more so than other viruses that we've dealt with?
Not particularly. This is the same sort of virus you want to take common sense approaches in staying healthy. Washing your hands after you've been out in public and touching things. If you're sick, staying home if you can. And if you have to go out when you're ill, wearing a mask to prevent spreading it to other people. And then if you're at risk, maybe taking more precautions in terms of avoiding sick people.
According to the CDC, cases have been increasing quite a bit since November. Is there any real cause for concern on this, or is this just kind of something, because I've been hearing a lot about it from people lately, and I wasn't really, to be very honest, too familiar with just exactly how serious a virus this was. That's why I'm so happy to be talking to you about it. But is there great concern here, or is it, as you said, just another kind of virus that you just deal with?
I think it's mainly a virus we deal with. Again, if you have chronic lung disease like asthma or COPD, or you have significant heart disease, or you're immunocompromised from cancer treatment or some other cause, you need to be concerned about this. The general public, you don't want to get sick. Yeah. So again, those common sense approaches of washing your hands and avoiding sick people are the most important thing. We are much better able to diagnose viruses now than we were pre-COVID, which is a good thing. But it also means we're much more aware of what's circulating and what the numbers are than we were before the pandemic.
And I guess my last question for you, if somebody suspects that they have this, what should they do? Anything different than normal?
Nope. Supportive care, take medications to treat your symptoms. And again, avoiding other people to try to avoid spreading it, because no one wants to be sick.
That's for sure. Okay, hope we can allay any fears that people may have had that there was another pandemic on the way. Doctor, thank you very much. We appreciate that. That's Dr. David Hill, chair of the National Board at the American Lung Association. We do appreciate you joining us this morning, Doc. Thanks.